The orthopedic, urology, dentistry, hair, everything is done with stem cells. This is the concept of this floor in our clinic.
Good morning. So we just had breakfast and now we're on our way to the clinic. Today is a full day of training, hands-on. We're gonna see a couple of cases of adipose-derived stem cells and a couple of cases of bone marrow for several applications. The car is right there, all the doctors are ready, and we're pumped up and ready to start.
This is the Health Valley of Istanbul. 1,000 private doctors' offices and 3 hospitals and around 10 pharmacies. So let's go together. This floor is the regenerative medicine polyclinic and clinic of the hospital. So we will be spending our time here, but I want to show you the connection with the hospital and then we will come back here. So this building is connecting with this tunnel to a hospital. So you can come, I want to show you. The IC brand that you will be seeing in our clinic is coming from Istanbul Cerrahi Hospital. So we are working together as a partner with Istanbul Cerrahi Hospital, but Regen is our brand. So the clinic calls Regen IC. So we are the regenerative medicine clinic of this hospital. So we see how, if we have complicated cases, if we need to use any imaging systems, laboratories or operating rooms, this is why we have a partner hospital. This is the main entrance, and then we go to the other part of the clinic, a waiting area, which will be also open to us. And you see there's also a TV here, where you are here drinking your coffee, you get tired, you can still watch what's happening. Here is another room. Most of the time our plastic surgeons and myself we are using. We have the 3D Vectra machine here and they're taking pictures, the analysis, and we will be showing you some of the cases. There's also a TV here. We do have, if anybody needs to get their teeth checked, my sister and my brother-in-law you met, we do have the dental box. This is the dental system. So everything is done here. The orthopedic, urology, dentistry, hair, everything is done with stem cells. This is the concept of this floor in our clinic. Good morning, everyone. Tuncay is a tissue engineer. She is a PhD. And you will be seeing your microscope, 3D bioprinting.
That we're gonna be working with today. We're using as an ink a stromal vascular fraction to create tissue for burns and wounds. Well, we're here in the clinic. We did a tour. All the doctors are excited. We have divided the group. The group is quite big. So we have divided the group into 2, and then the first group is gonna go and do the first patient from beginning to the end, and then they'll switch. The second group will do the second patient. And at the end, we will be seeing aesthetic cases. A couple of aesthetic cases where we're going to be using exosomes and platelet-rich plasma for facial injection, acne scarring, and such. So stay with us. What he did here is basically he did some anesthetic in the skin, and he punctured with an 11 blade, and then he is introducing the infiltration cannula. It's always parallel to the skin. You're going to see it in the next patient.
You have 2 levels. The superficial and the deeps. For this kind, it is better you go the deeps, okay? Because if you go superficial, you have something in the surface.
Rippling.
Yeah, rippling.